Welcome to the project kickoff and the implementation of the Code Stroke project. And thank you all for being here. We're going to start this presentation by covering a couple of things. We're going to look at the problem statement. Why are we here? Look at our stakeholders and who is going to be part of this project. Our proposed solution. Our timeline for the project. And our communication plan so that we can make sure that all the expectations are met from the get-go so that we can have a successful project. Our problem statement. Why are we here and taking the time to make a change? Only 30% of the time are patients that arrive to the emergency department via ambulance who are identified as having an acute stroke and are candidates for thrombolytic therapy are receiving the medication within 60 minutes. And as we know, the standard of care based on medical research put out by the American Heart Association and American Stroke Association is that patients have a better outcome. We reduce the effects of the stroke and even limit death to the brain by getting patients this medication therapy for the candidates to get this medication within that 60-minute length of time. So our goal statement is to treat 100% of our patients who arrive to the emergency department who've been identified as having an acute stroke and are candidates for this thrombolytic therapy. Our stakeholders, who is going to be the participants to make this happen? Well, starting from the top, we have our executive team members, our chief nurse officer, and our QI manager, and we are going to keep them abreast of what is going on. Our medical directors of the emergency department and our emergency medical services will also be key players in this project. Our stroke coordinator, who oversees the entire stroke program. The pre-hospital care coordinator, of course, the liaison between our hospital and our emergency medical services folks. And then our external agency, our ambulance company, the general manager who works with the clinical coordinator and the ambulance supervisor or lead paramedic who will help us to educate their staff. The ED staff, the director of the ED and the charge nurses, who will then coordinate with our staff within the emergency department, and our radiology team, our director of radiology and the lead technician, who will then coordinate with their team within that department. So how are we going to make this happen? Well, the proposed solution is once our code stroke is announced overhead from getting pre-hospital notification of a patient arriving to our emergency department, our standard routine will have code stroke, and then once the patient arrives, we will have them go direct to CT on the ambulance gurney. So that is going to be the change. Currently, as we know, the patient arrives to the emergency department, we put them in a room, we do our assessment, we register them, we do what we need to do until we get them to radiology. The proposed solution, or how we're going to make this change, is to not even offload the patient in the ER. We're going to keep them on the ambulance gurney and send them directly to the CT scanner to save that time. Now that's why we need extensive coordination with the ambulance companies so that they change their process and that all the process change will flow in accordance with everybody's standard operations. I put in here our elevator speech. It's very important when we're in a project and working on change that we can be cheerleaders, if you will, for our change project. And a little elevator speech is we have a new process for code stroke patients arriving to the ED via ambulance. They're direct to CT scan. Yes, our first responders are taking the patients directly to CT scan, and the emergency team, physician and nurse, will go with the patient. That way, we can get our patients that require thrombolytics within 60 minutes or less. This is very important. The how we're going to make this happen, and also the excitement for the team that we're doing good for the patient, as well as meeting all of our regulatory metrics. So the proposed timeline is this is the outline. Sometimes there will be a little bit of change, and there is overlap in the timeline while progressing forward. But the defined period is 2 weeks. The measure phase is a couple of days. Our analysis phase is 4 weeks. Our improve phase about 10 days, and the control phase about 4 weeks. So that gives us our project time frame of about 3 months. Our communication plan is very important for the overall success of this project. The external agency and all of the affected departments, our emergency department, radiology, laboratory, we're going to have weekly communications, and they're going to include a very simple bullet points that outline the week successes and the week of identified opportunity needs. If there's anything that's specific that needs to go to a specific department that's not a more generalized, a separate email will be sent to that person or that manager or that department to ensure the success, the communications to that specific person or department. The executive team members and the management team, the QI manager, they are going to get regular updates. Now those will occur during our regularly scheduled status meetings. And they're going to be high level communications so that they know what's going on and can speak to it. But they're not going to know all of the detail of what the work is being done underneath. The steering committee, the stroke coordinator, the pre-hospital care coordinator, and the champion or the project leader, we will be working on a weekly basis in person, a working meeting, and that's for a couple of reasons. We need to stay connected with one another. We need to stay up to date on how the project is going, the ups and the downs. We need to essentially work out any wrinkles as they appear. We need to encourage and validate our processes that are going forward. And if any changes need to be made or tweaked along the way, we can make those happen as well. Of course, this is a gray area. If the meetings need to happen more frequently, then that will be scheduled as appropriate. In conclusion, I just want to leave you with a cute little picture there of our dogs. Teamwork, working together gets the goods. Again, thank you for your time. I'm excited about our project to kick off, and please feel free at any time to contact me with any questions, any concerns, and together, again, we will make this happen. Working together, we'll get the goods. Thank you.